So you twisted your knee or had a small sprain in your knee joint, wondering if it's a major issue, should you get it checked, should you get it treated? Well, if you treat something early, you have a return of full function. If you sleep on it, then you keep sleeping on it. So I'm Dr. Aditya Sai. Welcome to our channel of the Shoulder and Knee Clinic, where we discuss various issues pertaining to sports injuries, knee issues, shoulder issues, and so on and so forth. So a very interesting thing that happens in our community is sometimes when you have had an injury of the knee, let's say you are running and you started getting pain in the knee joint, people tend to ice it, rest it, see whether it recovers or not, and more often than not they tend to sleep on it. Well, is it the correct approach? Yes, to an extent, because majority of the injuries are minor inflammations or sprains and they will heal on their own. But the issue comes is when you are afraid to visit the doctor, when you are afraid to treat it properly, that is where you will end up with problems. It's very important that we maintain our lifestyle, we maintain our fitness level, do exercises. Nobody is stopping you from doing that. But what happens is we are afraid to treat the problems and diagnose it. If they become persistent, we tend to sleep on it or decrease our activity level to compensate for it. That probably is not the right approach. I'll give you a very good example. So most common injury in runners is actually a patellar tendinitis, which is due to muscular imbalance or muscular weakness around the knee, typically causes pain in the front of the knee. So majority of the times in most of the runners, if you do exercise strength training, these issues don't happen, and the treatment for this problem is also strength training. But a lot of times people sleep on it, they don't get it treated, and then it becomes a chronic problem. It requires injection and treatment which is not very well defined. So treat it early, you will recover faster. People sometimes while running or let's say even doing gym, they have a twisting of the knee. The knee may swell up, you may get some pain on the inner aspect of the knee joint, it will settle down. But what happens, it becomes a niggle and people keep on ignoring it till it flares up one day. These can be meniscus tears. So typically the time between the onset of the symptoms to the flaring up can vary anywhere between 6 months to 6 years, and people ignore it till it's there. What happens is if the meniscus tear was picked up early, something could have been done, whether an injection or surgical treatment to enable the meniscus to heal. Now, if you come with the same meniscus injury after 6 years, then the initial healing potential is gone. Even if we attempt to repair it, the chances of a re-tear are higher. So that is where you end up if you don't treat the problem initially. Again, a common example is some footballers and younger athletes. They have twisting injury to the knee, they get ligament tears. Now, a lot of times these things are managed non surgically, even in athletes. What happens in athletes is if it is managed non surgically, then over a period of time, the abnormal biomechanics sits inside the knee joint. There is wear and tear of the cartilage. There can be additional meniscus injuries. Had we treated it initially, where only the ACL tear was there, where through surgical treatment the ligament could have been reconstructed, the individual would be walking the same day of the surgery. They could have been discharged the next day, and typically by around 4 months, they would have started running. They would have actually felt normal by 2 months itself, but they would have undergone the rehab and returned to full sport. What happens in a lot of scenarios is these are ignored or not treated surgically, and then the athletic potential declines, the knee wears and tears, and they come after 10 years or 15 years, where there is already misalignment in the knee, cartilage wear, or meniscus injuries, and then we treat them at that stage. It becomes a more complex surgery, takes longer to recover, and you can never recover the full function of an athlete at that stage. So that's the difference. It should not be a scenario that you should be afraid to visit a doctor for your knee problem. As I said, in women, there's a very common problem known as pes anserinus bursitis. So, in the inner aspect of your knee joint, the hamstrings muscles are there. Between the muscles and the bone, there is an empty space called a bursa. So, it can get inflamed and cause significant pain. The treatment for this is mainly physiotherapy or maybe an injection, but it's a non surgical treatment. If people go ahead with this treatment, they are able to return to full activity. However, carrying on with a niggle restricts your activity. So it's a conscious choice that you have to make, that you have to fight the disease, get over it, and resume your full activity. So, guys, if you like our channel, if you like what we are talking about, then spread the knowledge, do share, like, and subscribe to our channel. Thank you. Keep watching.